to talk on the topic, a very interesting topic, myths of low back pain. In fact, we all know that 80% of the people will have significant amount of back pain at some point of life. Back pain symptoms vary from person to person. Misinformation about low back pain is very common, and the spread of falsehood may adversely affect those who suffer from it by increasing levels of pain, disability, missed work, medication, and healthcare utilization. Myths often cause negative emotional responses such as fear, distress, and loss of hope. So, here we'll try to demystify a few myths. Now, the most important myth patient have in their mind is if I have a low back pain, it has to be a slip disc. Your discs are actually very strong structures and they simply cannot just slip out all the time. So, definitely, slip disc is a common cause of back pain, but there are a variety of reasons for back pain. So, it's not always a slip disc. So, when your patient comes to your OPD, most of the patients will say, Doctor, I have a slip disc. The next important thing is your parents, your teachers would always say, please sit up straight and please straighten your back. You're spoiling your back. Okay. But basically, slouching is not that an evil. Only thing important is that you have to keep on changing your posture. Like we know that slouching in chair will definitely help because the disc, intervertebral disc, basically drives its nutrition from fluctuation in the intradiscal pressure. There is no other way of providing nutrition to the disc. So the fluctuation will only happen if you keep on changing the posture. And in a straight, stiff posture, the interdiscal pressure will be so high and the disc health will suffer. So it is always better to keep on changing the posture. In fact, should get up from time to time just while you're talking on the phone or you're reading. It is better to get up from the chair instead of sitting all the time. Nowadays, most of us are working from home, especially during these COVID times. Most of the IT professionals are working from home. They are at the computer, at the laptop all day long. So there are a few important tips you should follow while sitting on the computer so that you don't have back pain. Basically, one is that you should always support your back. Adjust your chair so that your feet rest on the floor. Place your screen at eye level. Have the keyboard straight in front of you. Avoid wearing bifocals because that's where you're going to strain your neck. Make objects easy to reach so that you don't have to keep on slouching your back. Take regular breaks. That means get up, go, take a glass of water, come back. So that way you will have, again, the same reason I told you, the variation in the intradiscal pressure, and definitely sitting for prolonged hours will not cause any backache then. Now, another myth is don't lift heavy objects. And people with backache will always avoid picking up heavy weight, saying that I have a backache, I don't want to pick up weight. Basically, it is important how you lift the weight. It's not just the weight you are lifting, it's how you do it. When lifting, try to be close to the object as possible. Squatting to make the lift is very important. Use your legs to lift. Don't torque your body and don't bend it also. And lift very carefully. Do not attempt to lift heavy weights beyond your capability. So you can do weight training by gradually increasing the weight. Even if you have back pain, you can still lift weight. Then another myth is that if you are young, you won't suffer from back pain. And back pain is a normal part of aging. Basically, younger people can come with back pain. And we have seen so many patients in our OPD. They have a different reason for back pain as compared to the aging population. But getting older doesn't mean that life has to become painful. While there are aches and pains that come with aging body, it is very important to stay physically fit, because exercises that is very important, because they keep our bodies strong, flexible, and they have a lot of benefit. Again, skinny means pain free. This is absolutely a myth. And true is that more weight pounds, more pain. People who are thin can also be at risk of back pain, especially those who are having nutrition and eating disorders, and though they can be osteoporotic. Keeping fit is helpful in preventing and easing back pain. Back pain is more common in those who are unfit or overweight. Those who only exercise intermittently, like the weekend warriors, people who go out and exercise a lot after being inactive for all the week, like they go and with friends and go for a marathon, and then are mostly these people are the ones who are likely to suffer painful back injuries, because they're not used to that exercise, and they because it is very important to have a physical activity daily. It should be a daily habit. Then another myth is that back pain can appear from nowhere. Basically, back pain sufferers often claim that one wrong twist in the morning or sometime, or simply bending, caused their injury, and they have come with a severe back pain. Basically, it's because you have not done the event triggered it though, but you have not done the properly. That is the reason that you get back pain suddenly. But weight gain, bad posture, using poor technique for lifting the objects are all the triggering factors. They can put strain on the spine and lead to seemingly out of nowhere spasms. Then another belief is that spinal anesthesia causes back pain. You will get a lot of patients coming to your OPD saying that, doctor, I had a cesarean section and now I have severe back pain after that. But actually, general anesthesia carries a similar propensity to cause backaches. The potential reason for spinal anesthesia causing backache could be the needle, could be the drugs being injected inadvertently into the tissues and the muscles. There could be a hematoma formation, or there could be overstretching of the muscles after the relaxation by the spine. All you have to do is give some analgesics, some anti-inflammatory, and some rest. And this backache gets relieved very soon. It's a self-limiting kind of back pain. You cannot have a chronic back pain following spinal anesthesia for cesarean section. Then an important, very important thing is, if your back hurts, you should take it easy, rest until the pain goes away. This is very wrong. And most of the clinicians till date, orthopedicians or my dear friends, neurosurgeons, they advise bed rest for so many days. But actually, bed rest should not be done for more than 48 hours, because that will lead to the inactivity of the muscle, and that will lead to weakness, stiffness, and deconditioning. So, strict bed rest was once common medical advice for back pain, but doctors today are more likely to recommend moderate activity as you heal. So, don't rest for too long. Exercise is going to make the pain worse. No. So, I need to rest. This is wrong. Basically, you have to strengthen your back by strengthening your core and your trunk. So, by resting and staying inactive, your pain is likely to take a longer to resolve. Whereas exercises, though gradual exercises, will help you regain your normal health and your back pain will be relieved. So, what's more important is gentle exercises, so that the blood keeps flowing, and that could help you elevating your mood and by releasing endorphins. Now, another important thing is, you will find a lot of patients coming to your OPD wearing a lumbar corset or a lumbar belt. And if you ask them, they say, doctor, I've been wearing this for a long time. Somebody advised me for my back pain. Basically, these are very bad for your back, because they're going to cause muscle atrophy, deconditioning of the muscle, and and then they might definitely deteriorate the back condition, and the patient, if has a slip disc, can have multiple slip discs because of that. In case, uh, actually, if you require stabilizing the back or limiting the movement of the back, as if in patients with pot spine or patients with surgery, it is better to go in for a tailor brace. Then another important myth we have is that you need the firmest mattress possible if you have back pain. In fact, people differ in their response to mattress firmness. Back pain sufferers can actually experience greater pain if their mattress is too firm, because it puts more pressure on heavy points like the hips and the shoulders. Conversely, a mattress that is too soft could lack the support necessary to allow proper um, movement. So, in both the cases, the person will wake up stiff and will have pain in the morning. So, studies show that a medium firm mattress is actually helpful. This one is actually helpful, and offers an ideal amount of support to help prevent further injury. Now, X ray MRI can always find the cause. This is a myth, and it should not be relied upon. There is a high false positive rate because patients with back pain can have normal x rays, and patients with impressive radiological abnormalities may be totally asymptomatic. So, evident radiographic abnormalities in the X ray or the CT scan or the MRI may not be responsible for the symptoms what the patient is having. So, you might find a lot of patients with disc bulges, herniation, and degeneration, and still they are totally asymptomatic. In fact, you're exposing the patient to over radiation. And the truth is, spine abnormalities are as common in people without back pain as they are in those who have it. And also, if the patient has muscle spasms or the ligament is strained, you cannot find that out on an X ray or a CT scan. So, the best way is to do a detailed physical examination. Now, another myth is if no specific back problem is found, the pain must be psychological. As you all know, there is no single test to detect the underlying cause of back pain. So you have to use a combination of clinical tests, especially, and even diagnostic blocks will help, especially in conditions which you cannot see radiologically, like the face and joint arthropathy, the SI joint dysfunction, or the piriformis syndrome. So, yes, true. Stress is an emotional experience that can cause behavioral and psychological alterations in the body and elevating the perception of lower back pain. Depression and anxiety are thought to be the most common stress related conditions associated with back pain. Another important myth is that slip disc always requires surgery. So patients will avoid going to the surgeons or the pain physicians that they will end up having surgery. So, but actually remember, surgery is very important if you have a red flag. Otherwise, surgery is normally not required. Only it is required in patients who do not respond to other positive interventions. Now, another myth is that if you have back pain, you just have to live with it. Back problems are often extremely painful at first, but most people improve quickly over the course of few weeks, and they usually improve even more after a few months. Still, it is common for back pain to return from time to time. The good news is that only a small percentage of back pain sufferers are disabled by their condition. Most can continue with their favorite sports and their favorite hobbies. Another misconception patients have that if they have severe pain, that means the injury is severe. Basically, pain does not always indicate damage. And it's the perception of pain and the threshold of pain varies from patient to patient. So, a similar injury can cause a different type of pain in different patients. So, it is not true that more the pain, that means more is the injury. Now, the take home message for today is that there's a big no to bed rest, hard mattresses, lumbar corsets, tractions, lasers and shortwave diathermies. Yes, posture, good posture, like I told you, weight management and exercises so that you can have muscle strengthening, stretching, and yoga are supposed to be done religiously in order to manage back pain. Thank you.